Adventist Healthcare is in Maryland, and we are going to be bringing them in. They are first in the lineup. We've done this in alphabetical order so that everyone is getting an equal chance. And I introduce to you Arper and Dan, Sonia, and Rukwaya. I hope I've got that right. So you got 10 minutes on the clock, Adventist Maryland. Go for it.
Awesome. Hello. Thank you, Tanya. Thank you for that warm welcome. Hello, everyone. We're excited to be here. My name's Opa Chiweshe, and I am originally from Zimbabwe. I serve as the manager for our International Nurses Program here at Adventist Healthcare, and we are located just outside of Washington, D.C., so we get to enjoy the vibrancy of the city and the historic and cultural districts, but we also get to enjoy the suburban Maryland. I've got a quick video that introduces our facility. I think the technical team will go ahead and play that for us just now.
In 1907, Adventist Healthcare opened its first hospital in Montgomery County. Since then, we've grown to become a comprehensive healthcare system, offering a full continuum of high-quality care across more than 50 facilities to thousands of patients across the Washington, D.C. region. With advances in medical treatments and technologies, a world-class team, and numerous awards and recognitions, we remain true to our mission of extending God's care through the ministry of physical, mental, and spiritual healing. Adventist Healthcare features 3 acute care hospitals: Shady Grove Medical Center, White Oak Medical Center, and Fort Washington Medical Center, and 2 full-spectrum rehabilitation hospitals, along with multiple outpatient rehab centers. Adventist Healthcare also manages Howard University Hospital in the nation's capital. We also offer a network of cancer centers, imaging locations, primary and multi-specialty care, and home care services. Adventist Healthcare is a regional leader known for world-class services in areas such as heart care, orthopedics, maternity, and mental health, and has developed the region's largest clinically integrated network with more than 1,700 participating physicians and providers working together to improve quality of care and patient outcomes throughout the region. Adventist Healthcare has all of your health needs covered. For over a century, we've stayed true to our calling to offer hope and healing by promoting wellness, providing outreach to the most vulnerable in our region, and serving our community with compassionate, high-quality care.
Thank you, technical team. Can you please bring forward our slides? Just have a couple of slides to share with you. There we are. That's us. We are close to the Washington, D.C. metro area. And go ahead and go to the next slide, please. So we get to enjoy the nation's capital, and we are also great access to the great outdoors if that's what you enjoy. We are a faith-based organization, and our mission focuses on a holistic approach of physical, mental, and spiritual healing, which we extend not only to our patients, but also to each other. Career growth opportunities. Hey, I think our slide is going a little bit fast. Can you just come back? Thank you. There we go. So career growth opportunities. I don't know how better to exemplify that, but to have somebody like me. I am an international nurse myself. I'm educated and born and educated in Zimbabwe, and to lead this program. So I understand a lot of the dynamics and anxieties and fears that our international nurses are coming in with. Now we can go to the next slide. All right, so we are excited about this partnership that we have with Connetics, where we've been able to bring nurses from more than a dozen countries listed on this slide. And today I'm excited to have some of those nurses come in to share their experiences. Let's go back. I have Dan, Rakaya, and Sonia here to share their experiences. We'll only have a few moments, so I'm gonna start off. Sonia, can you go ahead and share your experiences so far?
Great. So, hello everyone. My name is Sonia Anderson, and I work at Shady Grove Medical Center. I started in on November 28th. So, I am only a few weeks in. I am still in orientation. I chose Adventist Healthcare because when I did my research, I saw that, as its name suggests, that it is faith-based. So, it's run on godly principles, and I love that. Coming to know it more to myself, I see that there are standardized guidelines that help us to uh, communicate with people, even if you're meeting them for the first time. And I love that. Um, I'm still in orientation, as I said, and it's a very great program. I'm in medical surgical program, and the team leader there, she ensures that I am getting what I need to get out of it. They are ensuring that I succeed, and I love that.
Thank you, Sonia. I appreciate that. We're going to go next to Dan.
Hi, good morning. My name is Dan Pamonag, and I am an international nurse from the Philippines. And I started working at the emergency department since October 2022. Being in the emergency department of the Adventist Healthcare, it's really tough and challenging, but I learned a lot from my preceptorship and my coworkers because they are knowledgeable. And I love their standards, the way on how they deal with the people, with their patients during the codes, and they help my critical thinking to expect what will happen next. And also, I like their core values, which is the respect, integrity, service, excellence, and stewardship. And I also seen that every day. And there's also an equality, even if you're a doctor, a nurse, or respiratory therapist, or even ED or janitor, they treat it equal. Also, I apply these core values outside the hospital, especially when we have social gathering like in Thanksgiving, Christmas, and New Year. We all gather together just to vent out or share our experiences so that we cannot feel alone and we feel that we are not homesick and we can feel that we have family here. We also welcome new nurses who are coming here in Maryland, especially those who are applying at Connetics USA and Adventist Healthcare. And I'm excited to tour you around here in Maryland.
Great. Thank you, Dan, so much for sharing that. Last but not least, Rakaya.
Hi everyone, my name is Rakaya. I'm from Nigeria. I worked in the UK for about 2 years and in Nigeria for 6 years before I came to the United States. I joined Adventist Healthcare in the year 2022 September. One of the reasons why I currently work at Progressive Care Unit, and one of the reasons why I chose Adventist Healthcare was the opportunity for growth. I can tell you for a fact, in less than 6 months, I'm already orienting to be a charge nurse and assistant nurse manager of my unit. And that's very exciting because Adventist Healthcare is an organization that recognizes your abilities and supports you to grow, to get to wherever you want to be. And also, I'd like to let you know that the diversity here is huge. You meet people from different all walks of life, different people from different cultures. You learn to respect their culture and love their culture because we all treat one another like family. So I welcome you all in advance in the Advanced Adventist Healthcare. Okay, thank you.
Thank you so much, Rakaya, and everyone. We're going to go back to the slide. The technical team, thank you. So I couldn't have said it better than the team themselves. They talked about the diversity. We are 1/3 of our population here born outside the USA. So our patients and our staff are very complementary. They reflect our community. We have a great training program for our international nurses. They get to shadow their units before they actually join the teams. And that takes off that first day anxiety in most of us. We have a great individual preceptorship program, individualized. Sonia was just alluding to that. Career advancement opportunities. Hey, I'm so proud of Rakaya and many of our other international nurses who are taking up the challenge to go forward and do their specialty, whatever they want to go with. We will allow them that opportunity. Work-life balance. Hello, I don't know. We are 4 hours by bus. You can take a day trip to New York if you want to, less than an hour into DC. So we are really excited and look forward to you coming through to us, join us. Yes, we can also go and enjoy the museums, art, sports, cuisine. There's a lot in our area to enjoy. So we look forward to you joining us through Connetics. Thank you so much for this opportunity. I don't know if there are any questions in the chat that we can answer. I will defer to our technical team. I don't see any questions, but we will. Okay, your program's a majority for international nurses. That question quickly went away. But I will assure you, go through Connetics. When you apply and they send us your questions, we will be happy to get back to you and answer your questions. Otherwise, we really look forward to welcoming you through to Adventist Healthcare. Thank you. Oh, the question on the screen is more about how soon can we migrate to the USA? I believe Connetics will be able to guide through. That's an immigration question that I will let Connetics handle. I don't know if there's any other question. I don't see any other question. I'll take it back over to you, Tanya. Thank you for this opportunity. We are excited.
Hi, everybody. Thank you so much for joining us. I think that was a fabulous, fabulous presentation. So many great options there and so many wonderful questions that have come up in the chat. So we will make sure to answer those as soon as possible. I know that this has been so inspirational. I was just looking at one of the comments in the chat, Opera, that was, I think it was from Dimakatsu, who's talking about how inspirational it is to see a leader from Southern Africa in a leadership position. So we really are so grateful to have Adventist Healthcare Maryland as one of our partners, and we thank you for joining us. If you are interested in Adventist Healthcare Maryland, please go to the Connetics USA website and apply online. Our team are waiting online right now to help you and tell you more about this exciting opportunity.